Hello class, my name is Ronisha Jones and I'll be your facilitator today for this class. I have a question for everybody. Does anybody know anyone with HPV or cervical cancer? Okay. Does anybody know what HPV is? Okay, well, cervical cancer and HPV affects over 9,000 women a year. And most of them die, but there are ways to prevent this, and we'll go over this today, okay? What is HPV? HPV is a genital human papillomavirus. It's generally transmitted through sexual intercourse. There are over 40 different types of HPVs, and most of the HPVs, people don't even know that they have it. So that's why there's such a high risk of people dying, or women dying from cervical cancer. Cervical cancer. What is it? Well, as you know, cancer is when the body cells basically grow out of control. So, when cervical cancer develops, it's basically the cells growing out of control in the cervix. The cervix is located right below the uterus, in between the vagina. And right now, I'm going to hand you out a picture diagram of cervical cancer, or excuse me, not cervical cancer, but the female reproductive system. Okay, are there any questions about this picture? Yes, everybody has one, or all the women have one. Alright. Right now we're going to go over risk factors for HPV and cervical cancer. As you see, smoking is one of the risk factors. And this risk factor basically can affect anything or any type of cancer, or have your risk of cancer high, like brain cancer, lung cancer. Smoking just really affects the body. Low immune system, that's with people with HIV, lupus, rheumatoid arthritis. Their immune system's low already, so if you were to get the HPV virus, your body would be having a hard time trying to get rid of that virus. Chlamydia infection. That's, as you know, is a STD also, or STI. They just found research that shows that people who have had chlamydia in the past or currently have had abnormal pap smears. So you want to make sure that you use protection when you're having sex. Diet. Poor diet. Not eating enough fruits or vegetables can cause you to have cancer anywhere. But they've found that most people who have cervical cancer have a poor diet. So you want to make sure you eat healthy. Oral contraceptives or birth control. They've come to find that with cervical cancer or HPV, people who are on birth control have a higher risk. And this is probably because the hormones in their body from the oral contraceptives, you know, kind of make your body cell or your cells grow or kind of act weird or funny. So you want to watch that if you are using contraceptives. Multiple full-term pregnancies. They come to find that people who've had multiple pregnancies and delivered vaginally have a shorter cervix. So if you are to have HPV or cervical cancer, they find that you have HPV, or it's more prevalent in people who've had multiple pregnancies. Also, procedures that they do if you had an abnormal pap smears can cause your cervix to be short, so that could also cause HPV. Having or being pregnant at a young age or having sex at a young age, you are at a higher risk of having HPV and cervical cancer later on in life. Alright. So, ways to prevent it. You can get your annual pap smear every year. Follow up if you do have an abnormal pap smear. Make sure you follow up, because those are precautions to make sure you don't have cervical cancer later on. They can continue to check and make sure if you do have HPV that it doesn't progress to cancer. So make sure you get your follow-ups. Limit the amount of sexual partners. The less that you sleep with people, or the less people you sleep with, of course, the less risk you have. Also, if you are sexually active, make sure that you use protection. There are different types of condoms out there that you want to make sure, not just from HPV and cervical cancer, but from HIV. So make sure you do that. Now they have an HPV vaccine, Gardasil, that's out. You can get it from the ages of 11 to 26. If you're older, you can talk to your doctor about it and try to figure out how you can go back and getting it if you want it. It's an easy 3-series shot. First one is that day you get, the next one's next 3 months, and then the last one's within 6 months. So you want to talk to your doctor and basically your parents, if you have to, about this vaccine. And also, what you want to do is quit smoking if you are a smoker, or if you're around people who have or who are smokers, you know, getting secondhand smoke, you want to try to keep away from them or have them quit. This will also help you prevent cervical cancer or HPV. Alright, let me hand you this handout real fast. Alright. And this just tells you what they're screening for when they do pap smears and HPV screens. For the pap smear test, what they're doing is they're looking for any abnormal changes in the cervix cells. So they'll use a little scraper or brush and kind of scrape some of those cells off your cervix. It doesn't hurt. They're just trying to make sure that you're not having any problems down there. HPV test is saying that if your pap smear did come back abnormal, they can test for the different types of HPV that could be affected. If you did have an abnormal pap smear, they can tell which types of HPV that you have. Okay, and now as you see on the diagram, it shows a picture of the cervix and the person doing the pap smear. This is a simple scrape that they do to get those cells and check it in a microscope. Alright, are there any questions right now? Okay. Pap smears, like I said, you want to continue to make sure you get them every year. And most of the time, if you have it abnormal, depending on how, different the HPV or how low, if it's low grade, high grade, or anything like that, which we'll talk about later on. You want to make sure that first that you do your follow-ups. They can have you come back every 3 months or every 6 months until that virus has cleared up. Okay? Anything else? Okay. So right now, I have a video that I want you to watch to help you get a better understanding of HPV, cervical cancer, and also pap smears. All right, one moment.